the things that are going on in the day-to-day life you alluded to. It's usually sleep, I'm getting anxious, I'm having panic attacks. For the first time in my life, I'm having hopeless thoughts of just wanting to be alive. I can't get up in the morning, can't get out of bed, I go to work, can't focus. These are the downstream symptoms. And usually early in the work, we're not really understanding why these things are developing. The brain is like a computer that needs to be reset. And I think this is something we're learning in science just in the last 10 years. We used to think that the brain was just an organ that you lose a brain cell, go away, and that's it. Now we realize the brain regenerates, we get stuck. Most of us want to support each other. Most of us feel that innate desire to be there for someone going through a hard time. But when we're blindsided or we're already stressed out or we're going through our own things and we just don't have the time and space and attention to be there for someone else, it can be quite overwhelming.
An exploration of trauma, transformation, and triumph. Your healing starts here. Hello, and welcome to another episode of Through the Trauma Podcast. Of course, I am Amber, your host, and today I have with me Dr. Sam Zand. Now, he is a practicing psychiatrist and a recognized leader in the holistic mental health and psychedelic therapy arenas, and he has trained over 100 clinicians. He has quite an extensive resume in mental health and does some pretty exciting things. He operates the Metamorphosis Resort, which is an immersive jungle retreat center in Puerto Rico. This is dedicated to transformational healing experiences. He is the founder of Anywhere Clinic, Calm Clinic, and Better You, and he leverages all of his training in public health, entrepreneurship, and management to deliver compassionate, insurance-covered medical mental health services across more than 30 states. Wow. Mouthful of stuff you got going on there. And I'm so excited to have you here. Dr. Zand, thank you so much for joining us today.
Thank you so much for having me. And it's always a pleasure to talk about mental health. And really what I think is one of the most under talked about things is trauma. You know, we all have trauma. We all go through it. We all have a mental health journey. So I'm excited to elevate the conversation together.
Yes, I totally agree. I couldn't agree more. Actually, I think that it's something that needs to be talked about more, which is why I'm passionate about this podcast and about having guests on like yourself that are advocates in the space and can just bring a wealth of knowledge to people that need it. Because I think and correct me if I'm wrong, but I really believe that people probably struggle with mental health at some point in their life. Like almost everybody has some struggles, whether that just be like depression or it can be way more extensive, like an ongoing mental health things. But nonetheless, it's something that affects many, many people. So something that deserves a lot of attention and to be talked about and to help people feel like they're not alone, because that can be a bad place to be.
There's a common statistic that 1 in 2 people will deal with some kind of mental illness in their lifetime. And I don't love that statistic for a couple of reasons. One is I don't like calling it mental illness. You know, we're not ill, we're not sick. There's nothing wrong with us. I think when we start to think about that there's something broken, that trauma really wounded me in a way that I'm just not the same since then, I understand the sentiment and the feeling. But when we pathologize it as an illness, it makes it really hard to accept that this is something we're going through. These are just words. They're just semantics. So I would say we all have a mental health journey. 1 in 2 people could be diagnosed with a mental illness if they went to a health professional. But I think 100% of us have been impacted some ways emotionally, mentally, traumatically. And the more we can normalize that conversation and make it less the disease of the sick, I think then we'll all start to participate in our own healing and become more empathetic to not only each other, but ourselves as well.
Do you believe that there's a lot of shame around mental health? Still, there's a stigma to it?
So much stigma. And whether it's shame, as you alluded to, I grew up with this macho mentality, right? Just get through it. You know, we don't talk about these kind of things. Yeah, there can be shame there. Often there's manipulation. You know, we've been ingrained and told that from a young age, there's something wrong with us. The parent who takes their kid to the therapist or psychiatrist, but doesn't really have a loving conversation about why we're doing this. Instead, the kid just feels like, well, there's something wrong with me. There's so many reasons why we layer in judgment of self and judgment of others. And I think the more we can just talk about this freely and recognize that these treatments are great for some of us, and for some of us, maybe they don't help. But there's always something we can all do to really improve our emotional awareness, improve our resilience, improve our overall mental wellness.
So you bring up something that you kind of said it in passing, but I caught it there that, there's this idea, and I think this is prevalent among men specifically, where there's like this thing of, I don't know, it's when we raise boys, it's like they're raised to just get over things. And I've learned a lot from doing, this podcast. And one thing that I'm a huge advocate on is it's never healthy to store or trap these emotions or just like kind of push them down. We should be able to express those or, feel them, have a safe space to feel them or whatever. But do you think this is a problem specifically among men? Or do you think this is a problem that affects everybody? That idea of I have to kind of overcome this in kind of this masculine energy.
I think traditionally, when you look back decades ago, before mental health has become more popular, and 20 years ago as a psychiatrist, people weren't coming in and just saying, I'm having a tough time, feeling a little down. It was usually more so the extremes. It was suicidality. It was psychosis, things of that nature. And so unless you're falling in one of those extreme categories 20, 30 years ago, I don't think it was in vogue or even okay, normalized to go in and just say I'm struggling emotionally, especially for men. Whereas perhaps the demographics show more women tend to, over time, over the last few decades, seek mental health support. Men usually don't take that initiative. And if they do, it's usually a female partner in their lives who help them get there. And so we do see it in the numbers statistically that less show up. And I think culturally we see it as well. In American culture, one of the things that I think has really helped is prominent males who already show a toughness, perhaps professional athletes, perhaps first responder, that, masculine energy, we as boys think we need to really embrace that. Those kind of people in society that are already glorified for their athletic prowess, for their toughness, or their success or ambition, they're stepping up and saying mental health becomes a tool, not a challenge. It becomes actually something that improves my ability to be my best self. That example, I think, is really now causing positive changes in this conversation. We work with a lot of professional athletes who, whether publicly or privately, are seeing therapists or working in things like psychedelic medicine. It's a very different playing field now because competition is increasing, but we're recognizing that we don't need to hide the emotional part of the work. Actually, that can be glorified as a tool that separates us from the pack. So now, is it just men? No. I think women have a lot of reasons to hide things that they've gone through, whether it's family structure, the not wanting to put a burden on other people because they are the ones who are emotionally usually the sounding board for the family, the support for the family, whether it's just the same cultural norms that we've been going through for decades where, suck it up. Don't talk about your emotions. I think we all deal with that. And to an extreme, you see a softening of maybe the new generation where they're too emotional, right? And where is the balance? Because trauma dumping is another thing in society that we don't really talk about as far as etiquette. There's a time and place to share and be vulnerable. There's a time and place where it's difficult to receive and difficult to be supportive. And so this is part of the growing conversation of mental health, I think, is amongst friends and people who care about you and love you, we should be vulnerable. But how do we still have the appropriate boundary, not just be opening our emotions to every single person?
So that is a great question. And this idea of trauma dumping, I'm curious your thoughts on the balance there. Like, how does one find balance if someone's struggling through trauma or in the middle of trauma, or they believe that they have a story that can help other people that are been through trauma? Do you have recommendations for how to share?
Absolutely. Yeah. I think it starts with asking for permission, right? Most of us want to support each other. Most of us feel that innate desire to be there for someone going through a hard time. But when we're blindsided or we're already stressed out or we're going through our own things and we just don't have the time and space and attention to be there for someone else, I think it can be quite overwhelming. So if I'm going through something and I call a friend, a family member, a colleague, hey, do you have 10 minutes to help me process something? And if the answer is no, that's fine. We can find time some other day. But now I'm giving them the heads up that I need some support, and I'm actually going to probably lay something on you that might require a little time. With that, then yeah, they want to be there for me, right? And we want to be there for each other. I think the other thing we have to be sensitive to is often when we talk about what we're going through, it can be triggering for someone else who maybe is also going through something similar. It can be received in a way where it minimizes what they're going through, and now the focus is on this person's problem. And so there needs to be a little reciprocation and sensitivity as well. I think if we're caught in a pattern of just simply talking about our problems, have we ever asked someone else how they're doing? Had we ever said, now let's take 20 minutes. I'd love to hear what's going on in your world. Thank you so much for helping me through that. How can I offer the same for you? Have we been sensitive to the fact that maybe what I'm bringing up might be triggering? And those are the things I think if we just follow those two rules, we move from trauma dumping to being compassionate and vulnerable in a way that's mutually beneficial.
That's so good. And I'm glad you brought that up, because I have often wondered this in my own, as I try to navigate through trauma, and not even my own stuff, but then trying to help other people that maybe guests that come on here, or people reach out to me, I think because I run this podcast, and they ask me, and I'm like, as I try to think through that, I've really never considered from that perspective, I guess, of like, can trauma dump, and you have to be really careful how you proceed with that. But I have wondered this. I have wondered, how can one be positive? Because I believe in, words have power. I believe that, what we speak can manifest in our lives, and what we focus on expands. I do believe in that. I think we see that in so many areas of life. But it's like, if we also have to be real and transparent, and sometimes sharing traumas or sharing things that we've been through can be helpful and inspiring to other people. So I'm really glad you explained that, because it gives it almost balance, and asking for permission is brilliant. I think it's brilliant. It's something that I probably need to work on personally, is just in all areas, because that is true. And I think that if you've been in a place in your own life where you've realized, I'm going through something really tough and I can't handle anybody else's things right now, that being conscious of that when we talk to other people it's very empathetic, and it's very considerate, I think, to consider.
Absolutely. My role is very unique in that I'm running several companies, 80 plus employees who we practice what we preach. That's all so important to us. We want to make sure that if you're going through something, you feel safe talking to your colleague, someone who's perceived as a supervisor. It's not held against you. There's a delicate balance there, both on the comfort of allowing someone to share something vulnerable, and also just not taking advantage of that. And so that boundary of being professional, but also empathetic, we get to practice all the time professionally. But then you're with a patient, and I have my doctor hat on. And all of a sudden, what's going on in my head, in my world, none of that matters. None of that is priority. None of that actually is relevant to the hour we're spending together. And so that's a lot easier, to be honest, right? Because that's what I signed up for. And through this work, I have to recognize if I am being triggered, if there is what we call a transference or a counter-transference of emotions. Being there 100% for that person is quite meditative for me, because I get to shut it all off and just focus. I think the challenge lies when we're talking to family members, friends, coworkers. We're really trying to navigate that balance that you alluded to. It just needs to be done very intentionally, and being mutual about it, giving each other that space and asking for permission. There's going to be times when I say no. People call me and they, Doc, do you have some time? I'm going through something. And it's just, I'm so sorry right now. I don't have that time to give you the attention. So on the team might be able to help you if you call them right now. Or do you want to schedule a time tomorrow? It can be emulated in family settings, friend groups, work settings, all of it.
I agree with you. And how do you get people educated? Communication is so powerful. And it's like, we have the ability by communicating with people, and this is like through body language and through words, we have the ability to heal. We have the ability to hurt. And then we also have our own emotions on the flip side of that we're dealing with. But how do you educate people on handling these things delicately, empathetically? I mean, because sometimes having what you feel like is a safe place to share, and then having someone disregard it or invalidate it, or that can be re-traumatizing. I'm sure in your practice, you kind of teach this, obviously, among your workspace you do, but just in general, is there a way that people can kind of gain this knowledge?
Sure. I think the education is out there. I mean, you can find everything you need to improve your mental health, but it starts with what we're not talking about enough, is regulating the nervous system, is just being in your best state of body and mind to then have a difficult conversation, to lead by example. If I'm not my best self every day, and I had some kind of emotional reaction in a meeting, well, it's on me as a leader to process that, understand why I reacted that way, and then clear it up with everybody the next time, whether it's individual or as a group. But I can't do that if I'm still living in the emotion, if my nervous system is still reacting. And so I think it's important to model and practice somatic relaxation. I think that's the number one thing when we go back to the macho, counter mental health culture. The one thing that most people are realizing is our nervous system needs to be regulated. And that's a tool that we have. It's an on or off switch. When I talk to all of my patients about breath work, usually it's a little bit strange for them at first. When I talk to my veterans, I don't really call it breath work. I call it tactical breathing. When we talk to different demographics, it has to use different language, but modeling that is number one, because once you have a calm nervous system, then you can be repressed. You can not minimize, right? Because your mind is not somewhere else, it's present. And so at meetings, we start every leadership meeting with a 5-minute breath work or a somatic technique or a progressive muscle relaxation. It's modeling, it's practicing that I think creates a culture in the family setting, the traditional prayer, to sit down at the table and say beautiful things of gratitude and affirmation and intention for the world. That's modeling in the family dynamic how to be present, how to regulate our nervous system, and how to be just mindful. So I think that's what we need more of in society, because we've gone into this path of cognitive behavioral therapy, of proactive change, of lifestyle change, which is great. But if you're just changing the exterior and you're just changing all the thoughts and the thinking, you're in your mind, you're in the world around you, you're in other people's reactions. And I think that's where the huge overlap in this conversation lies, is recognizing that trauma has affected our nervous system, and whether it's micro trauma, compound trauma, whether it's just an acute reaction, being able to regulate, that's the number one thing.
I love all of that. That is great advice for anybody that's just struggling with that. And I think anyone that's on a health or a self-growth journey can attest to going and learning more about those things. I know meditation has been huge in my life and learning how to breathe, and don't think I'm great at it, but it's been definitely transformational in my own life. So I can attest to that. So I want to talk a little bit about the therapy that you do, which is, this is more for people who just can't overcome their trauma or can't overcome what, maybe it's addiction or mental health or whatever is really they're struggling with.
Yeah. Our practice is very holistic. We do all the traditional psychiatric work. We do all the traditional talk therapy, but we've also brought two really innovative approaches to the space. And one is ketamine therapy, which is becoming more and more popularized now. 10 years ago, I think there were 60 clinics in the whole nation. Now there's 1,600. And so it's becoming more popular, more mainstream. Ketamine therapy is a form of dissociative medicine. Some call it a psychedelic that actually helps to reset the neural patterns. So when we talk about regulating the nervous system, the brain as an organ starts right in the skull, but extends all the nerves through the body. And when we go through trauma, as you and your listeners probably well know, it doesn't just react us mentally. Doesn't just impact us emotionally. And so when we have a little trigger, when we feel unsafe, it's almost as if the entire trauma is happening again, because our entire fight or flight system goes off. What we've seen with ketamine therapy is that it helps to reset that pattern that has become programmed and hardwired and compounded by future events that we're all looking for evidence to prove to ourselves. Yeah, that's why I can't be safe. See, that thing I saw on the news, or that neighbor that went through that event. And all of a sudden the nervous system is programming. Ketamine therapy helps to reset that programming so we can reinstall new programming. We can start to practice patterns that we would normally do, talk therapy, behavioral changes. But all of a sudden we're programming that on a new hardware operating system. It's almost like you have 100 tabs open on your browser and everything's moving slowly. But then you reset it, you get to start a new browser and do a little bit more clear. And so that's metaphorically a little bit of what we see in ketamine therapy. It's been a transformational experience for people who felt stuck for a long, long time, or even a short time. And it becomes a tool that lubricates the mind.
How do you determine if someone is a candidate for ketamine therapy?
Yeah. First, there's just some reasons why we shouldn't do it. It's not for everybody. If you don't have good cardiovascular health, you've had a recent stroke, heart attack, things of that nature, we need to check your blood pressure and make sure that it's normal or near normal, because it can increase blood pressure temporarily. So we just want to make sure that their overall health is good. We can prophylax for that. If they had a history of seizures, psychosis, or severe mania, these are things psychiatrically we would screen out. If somebody's pregnant, breastfeeding, planning, there's medical reasons that we would rule out. But for the most part, if you have a comfortable setting, someone that can keep an eye on you at home, we do this work telemedically even. You can go to local offices if you need a little more supervision. But we're really just trying to focus on accessibility by lowering the costs, increasing the ability for people who really need this. So other than those contraindications medically, if you have the right system, structure, and support for this work, you can do it at home in the comfort of your own bed. And it's once or twice weekly. You can do it for a month, 2 months, 3 months. Some people stay on long term. Some people realize that after 1 or 2 months, that's the shift that they needed. And now the self-work continues, but they no longer need the lubricant.
So that was my next question. If they come to your clinic to do this, but I am curious, you said that they can do it at home. If someone was interested in doing this at home, they would need someone else there to kind of facilitate the...
Yeah. So our process is you check in with your psychiatric provider, and from the comfort of your own home, just like this over video. I think we've all grown comfort with telemedicine now. We'll do all the screening, make sure you're an appropriate candidate. And if so, we can prescribe it to a local pharmacy or a delivery pharmacy. It comes in a lozenge that you hold sublingually. And then we just want to make sure you have somebody in your life, loved one, a roommate, a friend, a family member, who can just sit with you during that time. And the experience lasts about 30 minutes to an hour. So they just want to keep eyes on you, make sure if you get up, they're holding your hand, walking you, you can be a little wobbly. It is a mind-altering sensation. And it's really described as a meditative experience. At higher doses, and when people get into other psychedelic compounds that aren't legally distributed by doctors and pharmacists just yet, right? They're in clinical trials. Ketamine is. This process, it's done in a way that's very intentional. And so we want to make sure that the person at home just goes through our online protocols, has the virtual guide that signs on before their first session, and make sure they understand what it's like. And in that way, it's very gentle. And it just kind of helps us check in with ourselves. It's, for many, a first introduction to what a meditation feels like. I think in society, we all just, minds are running. It's hard to slow down. And so when we ask people to work on their breathing and slow it down and maybe close their eyes and do a visualized, it's really challenging at first. I do this work often with athletes, and they're good at visualizing their sport. But once they can slow down the mind, all of a sudden they can enhance their craft. With this medication, all of a sudden people who just tell me I can't ever slow down, and then it becomes easier, it becomes a practice.
Is there directives when they're in this meditative state? Like, does someone direct them, like, envision your game, or does your subconscious take you through that process of like what you need to focus on?
Great question. There's really two ways of doing the work. One is a higher dose where it's very passive. You're going up from this subconscious journey. You're just holding on for the ride. We always encourage eye mask and headphones, and you just see what the subconscious wants to teach you. You just become an observer. That's very meditative in its own right, but it's not very proactive. At a lower dose, you can engage more. And so if we assign visualizations, if we assign inner child work, all of a sudden you can go through those steps, practice it, rehearse it before. And as you get into it and you feel the medicine kicking in, you can re-engage. That 20 to 30 minutes can become a very powerful dissociative experience, because someone, for example, who's gone through trauma, all of a sudden they're able to engage with that same memory without the emotional charge that they once had. And now when they're a little bit removed from the experience, when we talk about inner child work, the directive is give that younger version of you all the love, encouragement, guidance, reminders of safety that maybe you didn't have at that time. And now we can actually reprogram the mind in that way through this work, similar to what we do in hypnotherapy. Your listeners are familiar with EMDR. There's a practice where we try to put the mind in that trance-like state as well. But to me, ketamine at a low dose is a cheat code. It's just, we get people there, they start to feel it, it's gentle, and then it becomes easier to re-engage.
Do you find that when you're working with patients, do you find that sometimes the trauma has been so bad that they have disassociated from that trauma to the point that they don't even remember it?
Yeah, absolutely. Dealt with a lot of repressed trauma. We had a patient who came in for anxiety, generalized anxiety, not too severe, but then over years developed the inability to go to the same work. This person, she had a very high intensity work. She was very good at it. The anxiety kept getting worse. Then she went on to get into working with kids, nothing too dramatic. And all of a sudden, memories started flooding back, just randomly. Severe trauma that she had gone through in the military. She had gone through not only sexual abuse, but it was, gang rape and a lot of just what comes after that is the residual compound trauma, shame, and judgment. It's all just flooded decades later. We weren't doing ketamine therapy at the time. We're just doing normal medication management therapy, but this developed in her own life where these memories came up. She remembers that after it happened, literally right then the brain turned it off. So you're never going to remember this again. It was very debilitating where medications, you think about the Xanaxes of the world, benzos to try to calm down the nervous system, just be able to quiet down and fall asleep again. None of these are long-term. None of these are sustainable. None of these options are safe for somebody as a permanent solution. With ketamine therapy, we're able to do one session, see how it goes, once a week, maybe twice a week. And for that, now all of a sudden, I can talk to this patient, whereas before, I couldn't even bring it up. But now, through the ketamine, just resetting some of that emotion, resetting the nervous system, we're able to now talk about what needed to be talked for 20, 30 years. But now we had a chance, whereas before, it was all Band-Aid. In my experience as a psychiatrist, I haven't had any other tool other than hypnotherapy that really allows people to get to the core of what happened.
So when they come to see you, they're struggling. I'm assuming they probably don't come and say, well, I have this trauma I need to overcome. It's usually that they're struggling with some area of life and they can't move successfully out of that area. Maybe they're stuck in a certain area and they can't move out of it. Do you see this is why people would come to see you initially, or do they come saying, hey, I have this trauma I need to overcome?
Yeah, usually someone who's new to the work, new to seeing a mental health professional, they complain of the downstream symptoms, the things that are going on in the day-to-day life that you alluded to. It's usually I'm getting anxious, I'm having panic attacks. For the first time in my life, I'm having hopeless thoughts of just wanting to be alive. I can't get up in the morning, can't get out of bed. I go to work, can't focus. These are the downstream symptoms. Usually early in the work, we're not really understanding why these things are developing. They just are. We think it's because our boss is an asshole or our spouse is being mean to us, or our kids are causing problems. And really, if we can handle all of those stressors, that's when we start to peel back the layers, right? And it's not session one. You don't sit with your mental health professional and all of a sudden I'm taking the scalpel into the heart, where we take our time. And it's all of a sudden just a light education of there are other contributing factors. And it sounds like, the experience you're having, it seems work related. But how are you doing physically? How are you doing psychologically? How are you doing spiritually? So to your question, yeah, it's people are more present to the symptoms they're dealing with in the day-to-day, the downstream symptoms. And we have to help peel back the layers and go to the upstream causal factors. And there's a very methodical approach to that. Step one is deal with the acute symptoms. Why are you here? What are we struggling with today? Let's make sure that improves before we even peel back the layers. Then number two is a neuroplastic reset. If you're familiar with neuroplasticity, that's the quality of ketamine therapy. And so this is where medication can come in. This is where just feeling optimism can be a neuroplastic reset. For the first time in my life, I have someone who's actually supporting me and helping me and figure this out because I was confused prior. After we get that neuroplastic shift, then it's the growth work. Then let's do the cognitive behavioral therapy. Let's do the lifestyle changes. Let's start to learn more about ourselves and what is contributing to the patterns we're going through. And then the really big important one also is community. We can't do this alone. And so we have groups, we have community engagements. While we're mostly a virtual company, we try to enhance the sense of togetherness. At the very minimum, you have a provider in your life, someone who's going to be there for you. Very vulnerable, intimate relationship where they're telling truths and secrets that maybe they haven't explored with anyone else before. And then finally, it's number 5, continuity. Got to continue doing the work. And it becomes a lot easier with that shift, with that support, with that ability for the brain to reset. It becomes more of a downhill slide rather than an uphill battle.
I think my thought process, I'm not a doctor, but just from the outside looking in or just even looking at my own inward self, I would think that people get to a place where maybe they heal from a certain trauma. Maybe there's layers to it that they got to work through. Maybe they do get to the bottom of that. And then there's more because we live in a world that we're constantly being inundated by different relationships, different toxins as far as environmental toxins and, all the different things that we're faced with on a day-to-day basis. Do you see people that kind of get to that point of healing, or is this something that people have to continue to work at for the rest of their lives?
Yeah, it's a beautiful question. And without having a direct black and white answer, I would say that we have to understand what healing means. I'm going through something. It's not comfortable. I don't want to go through this anymore. So if you ask them, healing means I'm not hurting anymore. I would give an additional answer, description of what healing means. Let's say you had a drunken night and you're done. Fight with somebody. You stumbled, you fell, you splashed your hand on some glass. Body can heal itself. You want to clean out the dirt and you want to get rid of the toxins. Any kind of trauma, you want to clean out the negative stories that we've created, the maladaptive coping mechanisms that we've created. You got to get rid of that debris. And then you need to let it be clean so that it can heal. You got to continue to nourish the mind in a way that keeps it pure, keeps it clean. We're not reliving traumas. We're not creating negative thought loops and patterns. Then it starts to reform, right? And we start to rebuild and reconstruct. My interpretation of that analogy would be, if you can look at that scar and feel good about what happened, recognize that what you went through was difficult, it taught you something, you probably stopped drinking like that because of it. You look back and you think of your growth, not of the hardship. If you can look at the scar and see the scar is beautiful, then you've healed. A lot of people who look at their scars with shame, with judgment, and they think that because of what they went through, even if it wasn't their fault, 9 times out of 10, it's not our fault. It's trauma being done unto us. They still see that scar as ugly. And I think we're truly healed when we can see our emotional scars as beautiful, because that shows that we've done the work, that we've grown, that the universe is happening for us and not at us. And that to me is true healing. And it often happens when we turn our traumas into our triumphs, when we turn our pain into purpose, when we start to be able to talk about what we went through with a sense of empowerment, maybe not even out loud. Not everybody has to share their story with the world, and respect privacy in that way completely. But internally, the narrative we tell ourselves, when we think back to what happened and the trauma that was done, can we finally say, I feel at peace with it. I accept what happened and I grew from it. I learned from it. Who I am today is beautiful. If who I am today is beautiful, then everything that happened to me is part of my journey. And that's a beautiful journey. And that's a beautiful scar.
That is perfectly explained. I'm like, that is so good. And I feel like I needed to hear that. And I'm sure many people in my audience need to hear that too, because I've often wondered that as well. Like, how do you know when you're fully healed from something? Because I think sometimes what happens in my own personal thought process through this is that sometimes it's like you get to this place where you're like, I'm healed. I'm at peace with this thing. And then later, sometime later, weeks, months, whatever, years even, you'll get triggered by something. And then you're like, well, where did that come from? Like, I shouldn't have got triggered. I overreacted. Why did I do that? And if you really think through these things, sometimes it boils back down to something from that situation, that traumatic situation. And you're like, I thought I was healed from this thing. But then you realize there's another deeper layer that you're called to heal. Does that make sense? Or does it
Absolutely. Yeah. I don't think that we're ever free from being triggered, free from being put into stressful situations that resurface old patterns. But it's how long does it take to respond from that? How long does it take to recover from that? How can we be aware and interact with ourselves in a way so that we understand, okay, I'm being triggered from this. And now the awareness is upfront in our conscious mind. And we're not living in our reptilian brain, which is reactive. If that awareness then leads to a coping mechanism that's healthy, take a deep breath, remind myself that what happened 30 years ago was a unique situation and what's happening today, then all of a sudden that healing will show itself. Emotional reactivity, isolation, despair, anger, whatever it might have been. So it is a journey. It's not linear. Like we got to a destination and it's over. We got to a destination where now one of my patients shared a beautiful analogy and he said, I look at my traumas now like Olympic medals, whereas before they were the worst things in the world to me. But now a signal of my bravery, my courage of what I've been through.
Going back to these tools, having the tools to manage those emotions, going through the trauma, but then you get to this place of like, I'm triggered. And that's why it's so important to have those tools that you can manage the emotions, manage what you're going through and be able to process through that trigger and see where that's actually coming from. Because I think a lot of times people don't realize where those triggers even come from and they just live in a reactive state. It's just reacting to everything. And I've been guilty of that. And until I got on this self-growth journey of I'm going to heal all this stuff because I want to be whole. I want to be healed. I want to be free from this stuff. And that's empowering to be able to get to that state and to be able to have the tools to know how to process through those things, which I think is why having mental health professionals and getting rid of the shame that's around mental health and the stigma, because it is so valuable. And this is something that has come up before here on the podcast as well, that grieves my heart a lot, is that I just don't think a lot of people have the coping tools to kind of move through that until they get into some kind of therapy or sit down with a mental health professional or even listen to, to someone talk about it like what we're doing here today. Just then you can empower yourself or educate yourself on how to move through those things. But, a lot of times I think it does take the help of mental health professionals or someone to help navigate through those things, especially if the trauma has been severe.
Yeah, we don't learn these things in school, right? They don't teach us emotional regulation, emotional awareness. They don't teach us even how to interact with each other. That's just, we're thrown into classrooms, not taught how to have interpersonal skills. We're just kind of survival of the fittest out there, right? And sometimes in the family structure, maybe there's a little guidance, there's some ethics and morals, there's some how-tos of just navigating life, but usually not, because they weren't taught either. And so it does come from education of really being intentional, learn psychology, learn mental health. And podcasts like yours and social media has done a great thing for the mental health community, because that has to amplify really loudly. I think when I see people who are really wanting to get into the work, the one takeaway from our conversation today, the brain is like a computer that needs to be reset. And I think this is something we're learning in science just in the last 10 years. We used to think that the brain was just an organ that you lose a brain cell, go away, and that's it. Now we realize the brain regenerates, we get stuck. And if we don't hit Alt Control Delete, if we don't, clean out the dust, if we don't just get in there with the sponge and say, like, all of these patterns that have been formed most of the time as trauma response, we can't just clean it out a little bit and just defragment it. And all the work we're doing it on a faulty system. And that's the one key ingredient that I've realized in my work has just been a night and day difference for people. The motivation to get there is still a challenge for many. But when they realize that there's a little bit of a shortcut, I can just literally reboot my brain into a place where those traumas aren't as strongly programmed anymore. And the work becomes easier. And so that's what I'm excited about and what I really want to amplify in the education that you speak of, with just, in addition to nervous system regulation and emotional awareness, that we all need that neuroplastic reset. And sometimes take a vacation, just go explore. Sometimes learn a new language, do something creative. And I need to get out of our own way or out of our own patterns sometimes. If it's as simple as taking a medication, and that's doable, great. But there are other ways as well. And that's just such an important part of the equation.
And where are you located?
We're in 30 states. And so our goal is to be in all 50 plus 5 territories. For the most populous states, we service telemedically, very low self-pay rates, and we accept insurance in about half states. So little by little, if anybody's interested in ketamine therapy and we're not in their state, there's tons of other resources in the community where we've pioneered this 4 or 5 years ago, but now there's many, many more.
Do you recommend ketamine therapy for any type of trauma, or are there specific types that you would recommend it for?
Yeah, I think if you've gone through something acutely very recently, a patient comes to me and says, life's been good usually, but I just lost a parent a year ago and I haven't been able to rebound since, or, I had some kind of traumatic event recently and I'm just not the same. We actually see such a quick response to treatment, because this is somebody whose previous programming served them well. Something happened to make that programming go awry, and now we reset it back to baseline. There was a documentary about the kids who got stuck in a cave in Thailand, if you remember, years ago. And when they got out of that cave, they were there for a week or two. Okay, they finally rescued them all. They all survived. They gave the kids ketamine to reset the trauma. That's someone who I think does the best, is they've just gone through something that needs to be reset. Because that's the person who, not all of a sudden, after 1 or 2 treatments, they say, oh, wow, everything's great again. But they say, I feel like I can actually make an impact on my own life. And that to me is the most beautiful part of this, the resilience. It takes time still. And for somebody who's gone through complex compounding trauma, it might take months or years, but the compass is headed in the right direction. And internally, that motivation is everything for that patient. Whereas before, they felt despair, they felt hopeless. Now they see the light at the end of the tunnel moving forward.
Well, I know that we have your website, but go ahead and tell my audience where they could find you if they were looking for this type of therapy.
Our practice is called Anywhere Clinic. You can find us at anywhereclinic.com. You can find my social handle at Dr. Sam Zand, and across most social media channels, you'll be able to find one or two of those. If you're looking for more education, we have a free portal to our patients, and so share that with your community as well. It's just portal.anywhereclinic.com. It'll teach you more about nervous system regulation, about ketamine therapy and the process that we go through alongside it. So you can always sign up for a free educational consult as well, and more.
Well, I have to say, this has probably been one of the most informative episodes that I think we've ever done. I've definitely heard about ketamine therapy. We've talked a lot about EMDR and a lot of these other therapies that help, but I don't know that I've had a doctor come on and explain it in such detail as you have. And so I'm grateful for that, and I appreciate it so much. And, I'm all for helping people find that modality that works best for them. And I think this gives people a lot of information to go on to know if this is, at least something that they should look into or get more information on. So I appreciate you so much for sharing all your expertise today.
Thank you so much for giving me the opportunity to come on and educate and really just share the message that we're all going through it. We all could use support. This isn't something that we should feel alienated or stigmatized by. And so thank you for the work you're doing to just normalize this work and show everybody that the more we can be there for each other, the more we can be there for ourselves. That just becomes a cycle of empathy that the world needs right now. So I appreciate the work you do. Happy to come back anytime.
Well, I agree with you 100%. And I know you kind of already give a final takeaway, but is there anything else that you would just like to leave my audience with?
Yeah, I'd say perhaps part 2 of our conversation, we can come back in 6 months or so and talk more about the spiritual side of our health as well. I think that we talk a lot about the physiological, the mental, the emotional. There's a part of science that we don't fully understand. I think in our work, exploring our system of beliefs, processing mortality, processing why these bad things happen to good people, or those ageless questions, it is a spiritual perspective that we need to explore. And so I just encourage everybody to, if you haven't really found a spiritual practice in any way, just start to journal, start to meditate, start to pray to yourself. And if you want some support there as well, I think mental health is an outlet where spirituality mixes with the understandings and the shortcomings of science. And so let's not let trauma ruin our spirit. I think more than anything, we need to talk about that as well.
Well, that makes me very excited because it's a conversation that I love to have as well. And I believe the body is holistic. We have to treat all of those systems, mind, body, spirit, everything. And it's something that I'm very passionate about. So I'd love to have you back on. So we'll set a time and definitely do that for the next conversation. So part 2 is coming.
Beautiful. Well, thank you so much. This was a lovely conversation.
Thank you.
I appreciate it.
Hey there, friend. Thank you from the bottom of my heart for spending this time here with us on Through the Trauma podcast. Your presence means more than you know. If this episode has spoke to you or gave you hope or made you feel just a little bit less alone, then I would love it if you would take a second, subscribe, leave a review, and share it with someone who truly needs to hear it. Every share, every comment, every listen, it all helps our message get out and reach those who truly need it the most. Healing happens inside of a community, and together we are breaking the silence and creating space for transformation. Thank you so much for being a part of this journey. Until next time, be gentle with yourself. You are not alone.